Hey everybody, this is Dr. Michael Hyland, Hyland Physical Therapy and Wellness. And it is now 11:30. Wellness Wednesday Live starts right now. So, I thought we'd start a new series now, and we're going to talk about what you can do to help low back pain, even if it's a pain in the butt, which sometimes it literally can be. The first video today, I just wanted to talk a little bit about, first of all, like kind of how to approach the situation. I think a lot of people that have either that initial kind of onset of low back pain, or even if it's a flare-up of a chronic issue, there's a lot of questions that might come up in your mind. So first of all, you've been over to pick up something. So let's say I was thinking of this morning, and it made me chuckle to myself because I was thinking, we're always bending over to pick up some kind of crap, right? So you might be bending over to pick up your dog's crap or your kid's crap, or not literally, but sometimes literally. and just bending over to pick up something is a very common way to throw your back out, right? Even if it's just a pencil, it doesn't even have to weigh anything. Especially if it's a big weight, though, that's an easy way to throw your back out if you're trying to lift a heavy load. It's not, hey Rosemary, thanks for watching, and it's not close to your body. A lot of times you're in that vulnerable bent over position, and then you feel that first twinge, and you can't straighten up. So I wanted to first talk about what to do if you're in that situation, and then we'll go from there. First of all, my number one trick of the trade for you is to say, assess the situation. Definitely need to assess the situation, because is it the end of the world? Probably feels like it, but it probably isn't, because a lot of times the worst thing about throwing your back out is it's a lot of it's just muscle spasm. It may not necessarily be that you ruptured a disc or something really serious like that, but the only way you're going to know either way is to assess the situation. So you're in that position, you just felt that twinge in your back, it still hurts, you can barely move. My first thought is take a deep breath and just say, am I okay? Are we okay? Can I move? A lot of times you may not think you can move, but it's kind of like, when I say assess the situation, what I think of is like, if you trip and fall, let's say you fell 10 feet off a roof, or any kind of injury like that, you've got thrown from your bicycle. You might lie there for a minute and just be like, am I okay? I think I'm okay. Can I move? Let me try to move. That doesn't hurt. No, that doesn't hurt. Oh, my ankle. So you're going to kind of get that. The same thing can apply to your back. If you have a back injury, that's the first thing you should do, is say, like, just kind of feel out the situation and say, what can I do from here? Can I move? Okay, let me try to move. So a lot of times the next step to me is to try to move in different directions, because you may notice that one direction or the other is more or less painful. A lot of times you might actually be able to find a comforting position even right after it happens. In a lot of cases, let's say you're like lifting something, big load away from your body, didn't use good lifting techniques, and you have that when you're coming back up. A lot of times coming back up into that position is going to be harder. You might try to roll onto your back and kind of have your back flat in a neutral position, or if you kind of have a little hollow in your low back, that's more of a neutral position actually. So try to find a neutral position, even if it means like rolling over on your back or on your side and just lying there for a minute. But I would highly suggest, as soon as you can, you stand up and you literally try to, if you're trying to assess, like, okay, does this hurt? Okay, it hurts more. Can I straighten up? Oh, I think I can move. I try to twist a little bit, side to side. Just try to gently explore which movements feel better or worse. And that will lead you to step 3, which is keep moving. So step 3 is to keep moving, because once you find a relief position, you want to go that direction, okay? With a disc problem, a lot of times, even if it's just a bulging disc, whether it's ruptured or just bulging, which bulging is better than ruptured, but we'll talk about discs later. That's a key thing, is you can actually discover, a lot of times it may not turn out this way, but a lot of times with disc problems, if you can kind of stabilize your hips and backward bend at the waist like that, doing that motion, 5, 10, 15 times might actually relieve that initial onset of pain. Even if it's back muscles, it actually could be the opposite. So like if those big back strap muscles are kind of on guard and on fire, bending over, and not bending over like standing necessarily, that could help, but if you're like on the floor, whether you're on your back or your side, actually pulling both knees up to your chest and just really stretch, kind of curling and bending your trunk, bending your knees to your chest, that stretch position could actually be very relieving, especially with a muscle spasm. Because one of the things about spasm is that if the muscle shortens more, it's going to spasm more. So sometimes it's counterintuitive to stretch a muscle that's trying to, pull together, but that actually is one way to relieve the spasm, is to stretch it as much as you can. Step number 4, and there's only 4 steps on my list, is keep moving, right? So step 3 is keep moving, and 4 is keep moving with an exclamation point. You don't want to just lie around and wait for the back pain to get better. It won't happen. You can, not that you shouldn't rest at all, but you definitely want to try to keep mobile and active while you're trying to get through it, because your body is going to respond better to movement. So the joints are going to stay flexible, the muscles are going to continue to have increased blood flow, and you're going to be moving those muscle fibers. So even if there is a knot or a spasm in there, actually using your muscles is going to work that out eventually. So movement is better than being sedentary. That doesn't mean you shouldn't rest and put a hot pack on it or something, or ice, whatever feels better, but you definitely want to keep moving early on. So I think that's probably the highlights of what we need to talk about this week. We just talked about assessing the situation, see, is it safe to move? Can I move? Am I going to cause more pain if I move? And if you can determine that you're able to move, then the next step is to try different movements to see what relieves the pain or spasm if there's a spasm involved. Number 3 and 4 are keep moving, because you always need to keep moving. Anyway, we're going to continue this series, and we're going to talk about different ways that you can help with low back pain, either through exercise or other ways, and we're just going to cover that week by week. So I hope you are going to enjoy that series, and I think you'll get a lot out of it. So pass this on to your friends, family, and neighbors. Like and share the video, and I will catch you next week. And here at Hyland Physical Therapy and Wellness, we've got your back. Be empowered. Have a great day.